Right, so it's 6:05, so I'll go ahead and get started. Hello, everyone who's watching right now. This is Dr. Quinn. We met back in 2015. She was the program director of South University and the director of nursing as well. So she is very passionate about educating students and the community. She loves to give good health nuggets. She is also my nursing mentor. She's the one I call when I have crises, and I love her, so she knows that. But I wanted to bring her on today because her passion is GI or gut health, colorectal health, however you want to kind of categorize that. So I wanted her to come on and talk a little bit about herself to start off with, and we'll go from there. So I'll mute my line, and Dr. Quinn, you can go ahead and start.
Good evening. Thank you for having me.
So you go ahead. You tell us a little bit about who you are and what you do so that they can kind of go from there. I know I have some questions for you. So you just start a little bit about who you are, how you came to be in this position.
Absolutely. So as Belia said, I am Dr. Quinn. I've had about 20 years experience in nursing, 11 of those, almost actually 13 of those now as a nurse practitioner, duly certified as a family nurse practitioner and an acute care nurse practitioner. I absolutely love education. It's absolutely true about me. I've spent time teaching in addition to practicing in undergraduate programs here in South Carolina, as well as directing a Master of Nursing and Science program that I had an opportunity to actually start from the ground up. What Ms. Sutton did not mention is that program maintained a 100% pass rate during the time that I was the director, and she was one of those people who was passing on the first go around. So excellent nurse practitioners that came out of the nurse practitioner program that are making huge moves in South Carolina and in other states right now. So really excited about that. I also definitely spent some time as a nurse practitioner in a gastroenterology practice for several years. Absolutely loved it. I've done primary care as well, so I get a little bit of it from both sides. I've seen the primary care side, the family practice side of things, as well as the specialty care.
All right. Yes, she was there. Listen, South, I was recommending everybody to South when I was there, but I don't know if I do that a whole lot right now because Dr. Quinn's not there anymore. But she was awesome. We had a good time. Boards were, definitely easy to pass, honestly, because she taught us everything we needed to know. So we appreciate that. Definitely me. I definitely appreciate you for bringing us through that program because it was challenging, but we made it. So we did make it. We made it. So I hear that there is a Color of Wellness magazine.
Yes.
Tell us a little bit about that and how we can potentially get that.
Absolutely. So the Color of Wellness magazine was actually created by Michelle Green Rhodes, who's nurse boss extraordinaire. She does help nurses get a lot of different things started. And I came on the inaugural season for the magazine. I came on board. I'm one of the executive contributors. And it's basically wellness for people of color by nurses of color. And it has been truly amazing. You get different perspectives that sometimes you might not necessarily get in the mainstream media. So you've got people who are taking the things that we've heard from our patients over the years. There's a combined experience of many, many years of nurses who are here. We've got mental health nurse practitioners contributing, nurse anesthetists, family nurse practitioners, registered nurses, professors, business owners and entrepreneurs. You can pretty much get anything inside the Color of Wellness.
Wow, written by women of color. That's awesome.
Yes,
that's awesome. How can we get this? Is it like a subscription?
So there's a subscription.
Okay.
The link will be provided where if you want to go ahead, and I definitely suggest that you want to do this. This is something that you don't want to miss. No other place has Black health been represented like it is in this magazine.
Right. Okay, so you'll give us the link at the end? You want me to? Okay. So we'll post the link in the comments. I'm gonna go just review the comments real quickly. Okay, my friend Naja said Valia talks highly about you. I do. Okay, so moving on. So because your love is GI and we definitely advertise this as colorectal health today, can you go ahead and just give us a spiel about colorectal health and I guess what we need to do to make sure our colons are healthy and intestines stay healthy?
Absolutely. And actually, my March article inside the Color Wellness magazine is about the crisis of colorectal health in the African American communities. There's so much that we overlook, we tend to overlook in our community about colorectal health. And there's a lot of stigma surrounding it. I think it's kind of hit everybody in the face this year with the passing of Chadwick Boseman and the other actor, the young lady who's a comedian, Natalie, who passed away, both from colon cancer within weeks or a month of one another. That kind of made everybody stop.
Right.
Some of us may know somebody who's had colon cancer, but we might not even know that that was the issue. One of the things that we deal with in our communities is that we don't talk a lot about our health histories.
Right.
We don't share it. People don't tell children grown folks' business. But some of that need to know information so that we can tell our children what we need to do to be prepared to take care of ourselves.
Exactly.
One of the surprising facts is that African Americans are 20% more likely to be diagnosed with colon cancer.
Wow.
40% more likely to die. That's a huge disparity.
Right.
Think about it. As far as compared to our non-African American counterparts.
It's crazy because I think our communities, we just suffer from a lot of barriers, whether it's financial, transportation, lack of education, which is, the main reason for me creating this platform is to help inform our communities of what's out there. What do you need to do? I mean, I have family members myself that are way over 50 and never had a colonoscopy. And it's like, in certain areas, this information is written down, is, told to you over and over again. Providers are checking to say, hey, did you already have this done? But then it's people of color who, it's sad to say, but it is people of color who typically don't get that rundown. Like, did you have this done? Do you need to go ahead and get this done? So that's why, one of my main reasons for creating this, so that I can let everybody know, people of color and people not of color, get this done. This is the time you need to get it done. So it's very important that, we recognize that age 50 is where you need to start getting a colonoscopy. Of course, if there's family members with a history of colon cancer, any cancer, you need to make sure you're in tune with that. But Dr. Quinn, can you tell us a little bit more about colonoscopies and what, I guess, any abnormalities people need to look for? When do we start to get these things done? Any histories we need to know about?
So absolutely. And there's been a recent change in the guidelines that for people of color, you actually need to start at age 45.
Okay.
Colonoscopies. And that's a very recent change. For years, the recommendations have been to start at 50, but people are being diagnosed with colon cancers at younger and younger ages. And because of the disparities and the increased mortality or deaths among people who are people of color, that age there's been enough evidence now to say, okay, we need to start screening these people a lot sooner. One of the other key things about colorectal cancer is that most colorectal cancers are diagnosed at later stages. So we all know that early detection is key. We talk about that with any type of cancer. But with colon cancers, a lot of times, by the time they're actually found, it's later stages. So it may not be, okay, we could just go and have a surgery and cut the cancer out and then move on. The treatments tend to become very involved in advanced stages of disease.
Wow. Okay. So I just want to add to just a couple of signs you may look out for, Dr. Quinn. Of course, you add on to it because I may miss something. But sometimes if your stools are really skinny, like a pencil or a pen or a marker, if you're noticing your stools have changed, The color, I think like a clay color, there may be a concern. Also abnormal bleeding that may not be related to hemorrhoids. These are things that need to be looked at. You know, don't just ignore it. Pay attention to it. Some people end up feeling really tired because their hemoglobin has dropped, and they become quote unquote anemic, if you will. So that just means low blood. And some people walk around and don't realize, you know, well, where's the blood going? And that's where you fight for yourself. You fight and you get these tests done, such as the colonoscopy, so they can rule out any bleeding in the intestines, or you want to make sure that they're doing everything they can to figure out where the blood has gone. So I just, you know, I want to push that, because it's crazy because I have a family member who is dealing with low hemoglobin, and he was released from the hospital and no one did anything additional. They just gave him replacement and they were like, okay, go on about your day. Well, where did the blood go? Where did it go? So this is why it's so important to have an advocate, somebody always fighting for you, somebody who knows a little bit about medicine, to go in and say, hey, you need this test, you need to go back. So I was the one that said, hey, go ahead and figure out when can you get a colonoscopy done. You need to figure out, they need to run that. They need to do some additional tests. And it's sad that we kind of blow off our people in the community of color, because it's like, hey, well, whatever. The hemoglobin was low. So where did the blood go? So just fight for your health, you guys. I'm sure I'm missing some signs.
Well,
anything else?
You actually have covered a lot of them, but one key sign is no sign. Oftentimes, colorectal cancer is asymptomatic. Sometimes people start developing gas and things like that, but by the time you become gassy, it's later.
Okay.
Who's having a lot of gas, and that's what leads them to the doctor's office or to the provider. A lot of times that's an advanced stage of disease. By the time you start having things that make you extremely uncomfortable, because while you're talking about the anemia, it makes you tired, but we come up with a lot of reasons that we're tired. We work hard. We're taking care of children. We're taking care of parents. We may be not sleeping well, different reasons, other things that are going on. We're stressed out. We're worried. We come up with reasons for why we're tired. And so sometimes, even though presenting to the healthcare provider is delayed, because we try to do all these other things first.
Exactly. Right.
So sometimes we don't pay attention to ourselves, let alone go and give an excellent history to a medical provider. And
right.
Sometimes depends on how hard does your medical provider push as well, because sometimes we can be great at going to a provider and saying, there's nothing wrong. I'm here for this or for that. But if we're getting adequate information about screening, getting your colonoscopy starting at age 45 or age 50, earlier, if you've had a first degree relative, meaning if you've had a mom, father, brother, or sister who had colon cancer, then you may need to be screened 10 years before the time that their cancer was diagnosed. So if their cancer was diagnosed when they were in their 30s, then you might start sooner with your screenings. If you've had a history of inflammatory bowel disease, as far as Crohn's disease or ulcerative colitis, that puts you at increased risk. But 80 to 90% of colon cancer risk factors are modifiable. And 80 to 90% of colon cancers are actually preventable. And we can change our lifestyle to actually modify that by being more physically active. Physical activity has shown direct correlation to decreasing the risk of colon cancer. The foods that we eat. Most people eat 5 to 7 grams of fiber a day, but our bodies need 25 to 30 grams of fiber per day. Yes, we need insoluble fibers, things that you get out of like fiber supplements, as far as Metamucil or grains. Soluble fibers as well that come out of fresh fruits like apples, carrots, green leafy vegetables, folic acids from these green leafy vegetables. The gastroenterologist who I worked with for years, I worked with a gastroenterology practice that's now closed because those providers have moved on to other things. But I worked with Dr. Burnett Gallman and Dr. Tomlin Suber in Columbia for years. They were excellent mentors. And the reason that I have such a love for GI now, but They actually recommend to patients to not only decrease your red meat consumption, but just to eliminate it.
Wow.
Altogether. Now, and one of them did eliminate meat completely. Now, I haven't done that, but
Oh, yeah, I need my little chicken wing.
right. But especially red meat. Red meat has a high correlation. And what do a lot of us eat on a daily basis? We come from sausage
Bacon,
country, bacon country,
pork,
and
pork.
yes. And I'm one of the people that when you
Mhm.
say bacon makes everything better, I'm on board. But at the same time, I know some of the risks that it can actually present to your colorectal health.
Right. And I've been actually just recently studying that a lot of your so heavy drinkers,
Oh,
your
yeah.
alcoholics, kind of leads to that issue with the liver. And then once the cancer kind of cells spread down into the colon, because everything's connected. So once it starts to spread, that's where people say it metastasize or spread all over. But I've seen this being linked to smokers and drinkers.
Yes.
So that is if those are some things that you guys partake in, then it's definitely it's recommended that you kind of eliminate or minimize, if you will. I know we're human, and look, someone commented bacon, bacon. Yes, bacon is put some bacon. Look, bacon grease in them greens and string beans and wherever you can put it, with some grits, whatever bacon and grits are most of our meals daily in the morning. So
Right.
definitely want to try to eliminate your red meat. So that's good to know. It's good. I commend y'all vegetarians and people out there practicing veganism because I'm not ready yet. I'm I like a hot wing every now and then.
Right.
But okay. So is there anything else? I know I want you to kind of let everybody know what you have planned next and how we can connect with you.
Absolutely. I do want to mention a few more things because I want to definitely talk about just some of the myths too that
Mhm.
people, make people fearful. There are a lot of things with having a colonoscopy. The fear of going in for a colonoscopy exam, uh,
Mhm.
the prep that you have to do. You do have to clean your colon out. And some people have heard, oh, you have to drink a whole big old jug of things. And there are some products out there, it's like a gallon of stuff, and it does
Mhm.
make you go, and it's not necessarily comfortable. But we have to realize what's the benefit versus the risk. Is
Right.
it going to be better to have a little bit of discomfort, maybe for 2 days, or experience colorectal cancer,
Mhm.
leading even to death? I mean, even just I was looking at some of the stats for South Carolina. We've already had over 700 people die from colon cancer in 2021
Wow.
in South Carolina,
Wow.
let alone the rest of the nation. Um, and we've had in South Carolina over 2,500 new cases diagnosed just in
Mhm.
2021. We're only 3 months in.
That's
So
crazy.
that gives you a little bit of a indication of what's going on, and also decreasing the fat in our diet. No more than 20% of what we eat every day should, or excuse me, our diet, we should have no more than 20% of the total calorie intake to be fat. We need some fats, but
Mhm.
we need healthy fats.
Right.
Um, and so we really want to just kind of be careful with that. But colonoscopies are definitely the gold standard. It's going to look for growths called polyps, and
Mhm.
polyps are slow growing. So oftentimes, if you go and get detected early, you might be able to catch these things early. There
Right.
are also other exams, but the two most popular is going to be colonoscopy and then the FIT test, which is a fecal immunoassay test, where you basically get a little bit of your bowel movement, and it's kind of placed on a little brush that is sent into a lab, and it's checking to see whether or not you have blood in it. Because another thing that people don't realize is they may say, well, I'm not bleeding when it's
Mhm.
my bowel movement, but it's called occult blood. You can't see it.
Right.
And
Right.
that is one of those things that if that test comes back positive, then you would go on to a colonoscopy. Usually that's done in someone who's low to moderate risk, but once you get to moderate to high risk, then the colonoscopy, they'll skip that step and move towards the colonoscopy.
Okay.
So definitely want to share those things because it's preventable.
Yes. Yes. And it's crazy because I know it seems so cliche, like, you know, you are what you eat. You are what you eat. And yet we still drive through the Rush's line and order a hot dog basket and double fries. But
right.
True. It is true. You have to be very careful, you know, everything in moderation. But before you move on to tell us what you're going to do, I'm going to read the comments, okay?
Okay.
So someone says, great information. I'm sorry, I can't see your name. I'm glad you're enjoying this. And also another person, or maybe the same person, just says Facebook user, so I apologize. But it says, can the stuff you drink cause you to be dehydrated after a colonoscopy? So I can answer that, and you piggyback on if you need to, Dr. Quinn. But so, I mean, yes, there is a risk because ultimately what you're doing is cleaning your bowels, and you know, you're going to lose some electrolytes. So what they should do is run fluids. If they need to during the colonoscopy, and of course, Dr. Quinn, you hop in with that. But most of the time, they'll kind of tell you to make sure you're hydrating yourself. So you make sure you're drinking prior to your colonoscopy. Because the main thing they just want to do is clean out the colon. And yes, that does, you know, you're gonna lose some fluids with that, but you should be drinking throughout the day. I mean, I think you're supposed to be on like a clear liquid diet. So you're supposed to be taking in everything you can take in, but you shouldn't, unless you're just somebody that's completely dehydrated already. Most people typically don't have an issue with cleaning themselves out and having to bounce back. I always encourage patients, if they're, you know, they sweat a lot, or if they, you know, have diarrhea, to make sure you're replenishing your electrolytes, which basically kind of keep your body in motion. You replenish those things with your Gatorade or Powerade, and that's putting those electrolytes back in your body. So when you're losing a whole lot, yes, you have to put those things back. But you shouldn't be in a state where the cleanser or the I guess Go Lightly is the name of it, should cause you to go into a state of dehydration. But if anybody that's dehydrated, and your labs will show it, they should replenish you with fluids before you even leave or get up off the table. But Dr. Quinn, you can if you need to add something else to that.
So yes, so you're absolutely right. You're not going to just stop drinking. While you will stop eating solid foods, while you're doing your colon prep, you will continue to drink and continue to hydrate yourself, and with clear liquids, because you want to avoid things that will stain your colon. When a provider who's doing your colonoscopy, you should see someone who's been specifically trained to perform a colonoscopy. So most often that's gastroenterologists who've had years of training doing this, because there are some risks. You can there's a scope that's actually being put in your rectum. It's going and looking in your colon's like 5 to 6 feet long. So that's a long way that they're actually going and taking a look. They're looking at the walls to see, are there any growths there? Is there any bleeding? Are there any holes there? And things like that, ulcers, things that are forming. So, but during the prep, you're going to keep drinking other fluids. So you would keep drinking water. You could drink broths that are not staining, but you do want to avoid like colored drinks and things like that, because they can actually stain the colon. You know how they stain your tongue? I always taught my students that your GI tract goes from your tutor to your rooter. That beginning at your mouth is a part of your GI system, all the way to your anus and to your rectum, where you pass your bowel movements. That's the whole thing, is your GI system. And anything that can stain your tongue, it can stain your colon too. So it's important to make sure that you drink those clear liquids, because if you don't clear out your system well enough, then you can go in. The provider can't see anything, because you may have stool, bowel movement that is in your rectum. So it is important to be clear and clean, but you will be instructed to stay hydrated and to contact someone if you have some difficulty ahead of time.
Right. And just to piggyback off of like the digestion process, it starts with the mouth. Some people who don't have teeth in the back, they can't chew their food very well. So I don't know, if you know somebody who doesn't have teeth, their digestion system is probably backed up, because if you don't chew and break that food up really well, it won't digest as well. So If you got to get you a partial or some dentures, then go ahead and do that, because you need that to help make sure your food is broken down while it goes through your system to exit. So, I mean, I know we don't pay things like that attention, but it's true. If you're missing teeth in the back, you can't chew your food, and definitely not steak, because beef just doesn't digest well with anybody, but especially a steak. I know some people learn how to chew on the gums, but it's not good for the digestive system. So get you some partials or something to help you get your food down a lot better. I have another question, Dr. Quinn. I'm gonna let you answer this one. I think it can clean your colon, but it says, can drinking lemon and water daily clean your colon?
So not in the sense that we're talking about cleaning your colon, because we're talking about cleaning yourself out with laxatives for the purpose of being able to have a clear colon when you have a colonoscopy. Drinking lemon and water, I think what most people are talking about are more along the lines of detox. And when you're thinking about that, you're thinking about the organs in your body that help to remove toxins that are byproducts of metabolism or digestion. And some of the organs that help with that is things like your liver. Like your liver is going to help detox different things that we eat. For instance, these meats that we talk about that we shouldn't eat, one of the byproducts of eating meat is ammonia. Well, it's our livers that help us to rid, our bodies of those things and things like that. So, you're like kidney function, liver function. So that's a little bit different. Not necessarily cleaning your colon, so to speak. Now, fruits will help you to maintain their fibers. So it can help in that respect, because you do want to have soft bowel movements. You want to have frequent bowel movements. But usually when you talk about lemon and water, you're more so talking about just kind of detox and not necessarily cleaning your colon, so to speak.
Yes. So I was gonna piggyback on like just the fruits and veggies. They say you're supposed to use the bathroom every time you eat. Now, I know everybody's different, but that should be an indication on how well your colon may be cleaned out, if you will, because you're supposed to, everything we eat, we're supposed to expel. So that goes with, just increasing fibers in your diet, trying to avoid meats or minimizing, because those things just slow the digestive process. It just slows it down. As good as it is, it will slow it down. So staying hydrated, of course, they encourage 64 ounces a day. Some have even gone to say half of your body weight. Exactly. So, if you're 200 pounds, then you need to drink 100 ounces of water. It's a lot, but you got all day to do it. So 24 hours to get it done. But so I think that's all the questions I see right now. If anybody has any additional questions, please leave them in the comment box. Oh, we got one more. Is taking a stool softener weekly okay if you're constantly constipated? So this is what I say, because some people do, and Dr. Quinn, you correct me now. Some people do have issues passing stool just by nature. They can eat and drink as much, everything healthy, and still have issues passing stools. But some people actually recommend stool softeners daily versus weekly, like a Colace over the counter. But lots of fluids if you're somebody that's not drinking a lot of fluids. And I've also seen too, I've been there. You try to eat all your salads, all your fruits all day, all week, and you're not drinking the water, you're not going to go.
And that's what I was about to add to.
It's going to bulk you up so much that you can't move. So you have to have that healthy balance. If you're going to eat your fruits and veggies because it's good in fiber, then you have to bring on the 100 ounces of water if you're 200 pounds. And I'm just throwing out the pounds. But
yes,
if you're 150 pounds, you need just 75 ounces like that of water. So yes, but Dr. Quinn, you add on to that.
Well, you actually brought up exactly what I wanted to bring up. You have to drink enough water. You have to have that balance with the fiber, because fiber can be used to treat constipation. It can be used to treat diarrhea. But it's how much water is, which way is it going to go? So if you eat a lot of fiber, if you add on a fiber supplement and you're not drinking water, then you're actually going to cause constipation. You have to have that balance. So definitely what you're talking about, I use the drinking half of your body weight. And I use one of those motivation water bottles that tells me, by 7 o'clock, you drink this much, 11 o'clock, all the way down. And I try to drink that every day. And it has actually worked well, because I would be one of the people who's guilty, especially in healthcare. We tend to start working and moving, and we're not stopping to drink water. And really, in any job that you're doing, most of us are probably not drinking enough water. And that's the main thing. But that is what's going to get your bowels to move, having adequate balance of fiber, insoluble fibers and soluble fibers from actual foods, fruits, and vegetables, and having that water on board. And if you exercise, you need to increase the water, because when you're exercising, that basic half of your body weight is not enough, because you have to consider the loss through sweat. So now you actually need to increase the water that you're drinking to compensate for the exercise that you're doing. And we all should be exercising, because that's one of the biggest indicators and protective factors of colorectal cancer. I mean, it's small. You know, we hold ourselves responsible for so much.
Yeah.
And we think that if we can't do it as if we're a professional fitness expert, then we can't do it at all. But we got to start wherever we are. And that's just one thing I want to encourage everybody, and I encourage my patients: start wherever you are and go from there, because doing a little bit more today was better than what you did yesterday. And then we need to celebrate every win. But there are some things that we can do. If you get the Color Wellness magazine, my article this month actually has an interactive plan in there. It says, hey, what are the things that you can do this month for colorectal cancer? How much prevention? How much more fiber will you eat? How much more water will you drink? When will you make an appointment with the provider? And one of the other things to mention is that, again, I'm going to revisit this. We've got to talk to our families. Got to tell people what type of cancers we've had, or what type of cancer grandma or auntie had. It's important.
Right.
But then also, we need to support people while they're going through these things. So many times, oftentimes people are hiding what they're going through, and you can't handle it as far as going to the provider and being proactive when you don't know about it. Another thing that we think about too, and there's some validity to it, is that there's a myth about allowing someone to do a colonoscopy because of how sensitive it is. You know, they're going through your rectum and they're going in this test. It takes a short period of time, sometimes 20 minutes.
And you're knocked out.
Yeah, right. And they give you medication. You shouldn't feel it. The tests are short. It's over before you know it. And there's definitely, the medical code is to keep your dignity. So even while you're knocked out, you're covered up. Although there's a camera with a light on the end of it that's going in your rectum, once that provider gets in, they don't leave you uncovered in those settings. People are protecting your dignity while you are asleep, when you've been given this medication to make sure that you're not feeling pain, and also to help you not be remembering this procedure as well. And also digital rectal exams. People can get those as well. I know that doesn't sound comfortable, but again, it's a couple of seconds to make sure that you aren't having issues, or that there aren't polyps or different tumors and things that you can actually feel in your rectum.
And you don't have to get a colonoscopy very often. So most of the cases are every 10 years, unless they see something. Then sometimes they encourage you to come back in 5 years. But y'all, it's, get it done, get it over with, put it down, write it down, and then 5 to 10 years later, you get it done again. So I definitely recommend, I know Dr. Quinn agrees, to go ahead and just get it done. If, like you said, if your family members, if someone like mom, dad, sister, brother had cancer, colon cancer, you need to make sure you guys get seen, get screened, find somebody that'll do it, because I know some people give pushback now. Some healthcare providers like, no, you don't need it. Yes, I do. Look, I got insurance, run my insurance. Yes, I do, or I got cash. Let me get it done, because like we say, prevention is key. So we don't want to wait too late to get these things done.
And definitely working with your provider to determine when the time is right for you.
Right.
because your time frame might be different from someone else's. But that's why we need to be able to give an accurate history, so
Mm-hmm.
that, because your providers are going to advise you based on what the guidelines say, but then they are applying those guidelines according to the information that you're giving. So
Right.
as your own advocate, it's very important that the information that you are giving is correct. And another key piece to mention: anytime anybody's noticing weight loss or bleeding,
Mm-hmm.
those are telltale signs that something is wrong. So, and really, and not only colorectal cancer, but it could be any cancer.
Mm-hmm.
Losing weight and it's unexplained and you don't know why, don't hesitate.
Mm-hmm.
Go get checked.
Right. Right. Another question says, if a polyp is found, is there corrective actions to get rid of them other than surgery? Now, I don't know a whole lot about GI, but what I kind of do know is sometimes they want to go ahead and surgically remove the polyp in case, even if it's benign, which just means, there's nothing wrong, there's no cancer there. Sometimes they can turn into cancer from what I'm understanding. So they do encourage them to go ahead and get removed. Some of them are so small, they don't touch them. So it just kind of depends on the surgeon, the gastroenterologist. But Dr. Quinn, you can go ahead and chime in with that one.
So there are a lot of different types of polyps, and more than what we probably want to get into talking about this right today. But your providers who are trained, they are trained to identify types of polyps. And a lot of times, if they are small, if they don't look like they're going to be too deep to cause excessive bleeding, etc., during the colonoscopy, they will go ahead and snip those off. And then they remove those. After they snip them, they kind of cauterize the area while they're in there to keep them from bleeding. But then those are taken and they're sent to the lab. And so that they're actually evaluated to see what type of polyp it is. It'll come back whether or not it's the benign, whether it's cancerous, whether it's precancerous. And there are certain types of polyps that are more likely to turn to cancer more quickly. And usually the amount of time that's recommended for you to come back is based on that. It's based on whether or not they found no polyps, whether or not they found polyps, and if they found polyps, what type of polyps were those? So if they found the polyps in your system that are more likely to turn to colorectal cancer, then they may say, well, we want you to come back in 3 years instead of 5 or 10, because that is the way that you're being monitored more frequently.
And just keep in mind too that you're asleep. So it's really, once they go in, if they see something, more than likely you'll sign paperwork prior to the actual colonoscopy saying, hey, if I see something that needs to be removed, you're okay with having that done. So it's usually not a separate, they usually don't bring you back to have them removed. Am I right, Dr. Quinn?
Correct. Unless there's something that appears that you can't do safely at that point in time.
Okay.
Like if a mass or something of that nature is seen, if it's a small polyp and there aren't any risk factors to this patient haven't done it, like if someone's taking blood thinners or something like that, usually they've given you instructions on how to stop those ahead of time and be transitioned to an anticoagulant that's safer, with a shorter half-life for you to be able to do what you need to do prior to having your procedure. So it takes a lot of planning, for people who have other comorbidities or other health problems. But you will get that information so that you can have this procedure safely. If there's something like a mass that's found, something that looks like it's too large or too dangerous to be removed during that procedure, then the provider would not do it, and they would let you know what the recommendation is. And they may send you to a colorectal surgeon. If it's a gastroenterologist doing it. Sometimes you may have had a colorectal surgeon that actually did your colonoscopy. If there's someone who's extremely high risk and providers think that there's something that could be there or could be wrong, sometimes they may even skip gastroenterology. They may just send you to colorectal surgery and they might do your colonoscopy.
Okay. Another question: can Cologuard mail home test replace a office visit? I guess. So I guess they're saying, can the home test kit replace a visit? I don't always recommend replacing visits. If you will. If you want to just say, hey, I'm in the store and I want to see if my stool has blood in it, then that is a way. But I always recommend that you be seen by somebody at least once a year. just for or just a general checkup, get your blood pressure checked, get some basic lab work done. So no, I don't recommend replacing visits. But if you're just curious to see if you're still like, say tomorrow, I just want to check, then yes, you can try to do that. That's okay to use, but it's not okay to replace a visit, if that makes sense.
I agree. It's definitely better than doing nothing.
Right.
But a home test kit is not going to give you a true representation of your risk. And if you're not a healthcare provider, then you may not be able to calculate your risk independently. Working in conjunction with your healthcare provider, they're going to be able to take into account all of your other healthcare risk factors to advise you appropriately.
Right. Okay. This has been awesome.
Yeah.
As a disclaimer, y'all, we're not on here trying to diagnose and treat anybody. We're just sharing some knowledge. So please, if you have any additional questions, you can email me or Dr. Quinn. You can definitely reach out to her as well. But she has some plans, I believe, for the near future. So I wanted her to go ahead and talk to us about that to see how we can connect with her.
Yes. So definitely want to encourage everybody, because March is colorectal Cancer Awareness Month and Colorectal Health Awareness Month. So definitely, you see a blue ribbon, wear blue before the end of the month. We've got a couple more days, and encourage somebody to get their colon checked. Also, I'm doing a lot of things right now, a lot of exciting things coming up. Enjoying working with people. I think what Valia is referring to, she and I talk a lot and work together on a lot of projects. I do offer mentoring and coaching to professionals, so personal and professional development for individuals who are looking to advance in their careers. I have experience maxing out pay scales and other things like that, helping people who are interested in starting their small businesses as well, and getting you on the right track to having those things started in a way that will protect you. Definitely exciting things coming up. We'll have some slots opening up in April for individual coaching. So I can be reached at hello@drjadaquinn.com. That website is coming soon, but this is going to be an extension of some things that I have been doing for years now.
She wears many hats, many hats. I mean, y'all could probably be on the phone talking about nursing and then she'll jump in with something else. So definitely reach out, you guys. Connect with her. She's awesome, full of knowledge and wisdom. So definitely my friend and mentor. So I do appreciate you for joining us tonight. I hope this was great. I see someone else said good information, so I'm glad you guys are receiving this well. I will continue to do these platforms weekly, and if there's any specific questions or specific topics that you guys are interested in, definitely email me as well. My website is, of course, in the Facebook group or on the page, and I can drop that down here as well if you need to connect with me for any reason. So I'll do my best to answer any questions that you may have or refer you to the right person. So
I just want to kick it back.
Go ahead. Yeah, go ahead.
Well, I am so excited about what you are doing right now. It's awesome and it's amazing. And as much as I love to teach, not even something, that I've done, this is just amazing. This platform that you are creating a safe space for people to come in and to be able to get questions answered. So often we don't answer questions or ask questions because we feel like, okay, this question might be a stupid question, or maybe I won't sound like I know what I'm supposed to know. But there's really, we know what we know, and we don't know what we don't know.
Right.
And we need to create environments where individuals can feel safe with supporting one another and getting the information that we need. And that's what you've done. So I want to commend you for doing that.
Thank you.
Amazing. And I know there are so many great things to come.
Yes, ma'am. Well, I appreciate that. I really do appreciate that. Sometimes you question, you like, was this the right thing to do? And then, I do get feedback, good feedback. And I'm just glad I was able to do that because, again, some people don't go to the doctor. I say doctors, some people don't see their healthcare providers. And, I just want this to be a place to encourage you guys to find a healthcare provider. And or start taking steps to make sure you're healthy and understand, that everything we do, everything we eat it leads to, you know, a healthy outcome or a bad outcome. So we have to make those decisions and those choices. So yes, I am free, you know, weekly to talk to you guys about whatever it is you may have concerns about. And I just wanted to be that person to be relatable, if you will, you know, just to kind of make you guys comfortable. I'm human too. Every week I try to relate. Like I said, with the fiber, I've done that, eating too much fiber. I deal with things just like you guys. So it's just, as a professional, sometimes we put on that white coat and we kind of forget, we do have credentials, and sometimes, and not us personally, but some people do get in these roles and they're up here and our patients are down here, and we have to meet them where they are. So that's just the key, meeting people where they are. So I do appreciate that shout out. So thank you. Does anybody have any additional questions? This was awesome. I'm going to drop the link for the Color of Wellness magazine once the live ends. And my website is there. Dr. Quinn's email is floating across the screen. I will type it as well in the comment box. All right, Dr. Quinn, I hadn't seen any more questions. Any last remarks? Are you good?
Thank you for having me.
It is no problem. I appreciate it. I'll be calling you, girl.
Absolutely.
All right, you take care. Thank you again.
All right, thank you.
Y'all have a good evening.